Hi, and welcome to the Ask Dr. Angela podcast with everyone's favorite OBGYN, Dr. Angela Jones. Have you ever been too embarrassed or shy to ask your own doctor about your, girl parts? Well, you've come to the right place to get straight answers. Feel free to ask Dr. Angela anything women's health related. Obstetrics and gynecology? She keeps it real. Pregnancy? She's been there, done that. Menopause? She'll get you through. Young or old, Dr. Angela's got you covered, girl. Now here's Dr. Angela.
What's good, people? This is Dr. Angela, everyone's favorite OBGYN, and I would like to officially welcome you to episode 174 of the Ask Dr. Angela podcast. It is a mad world. I play that on my guitar. I think that's Gary Jules, right? Anyway, that's a fantastic song. And it is a really mad, mad world. I mean, what's going on? Well, there's a lot going on. There's so much going on that we can't even really go into that. But the things that immediately came to mind for me are those recent fires in Gatlinburg. Crazy. And then this morning I woke up and I was reading about that fire in an Oakland warehouse. Crazy. And then, of course, folks are still walking away scot-free for killing black men. Just saying. Anyway, we're going to jump right into today's questions, which came to me from actually one of my labor and delivery nurses. I was on call not too long ago, and one of the nurses sat down next to me and said, Dr. Angela, I've got to ask you a question. I said, ask. And she said, I know that you don't do this, but why do some doctors at the time of delivery do that stretching in the vagina with their fingers? Does that add anything to the delivery process? And so, of course, I was like, no. For me, I tend to be really hands-off when it comes to deliveries. As a matter of fact, I tell most of my patients that the mom and the baby, they're the ones that do all the work. I just pretty much stand there and catch the kid. Babies do most of the stretching, if not all of the stretching, that the vagina needs during delivery. An obstetrician putting their fingers inside the vagina and stretching it and doing all that extra manipulation, in my opinion, does nothing but cause extra pain and trauma. So again, I tend to be very hands-off. I would love for someone to be able to show me where that technique is, supported in the literature. And I mean, when you talk about moms that don't have anything on board for pain, i.e. epidural, that's even more pain for them. So again, for me, I tend to be very, very, very hands-off. Now, this is really very different than perineal massage. Some people will place a warm cloth on the perineum or sometimes use something like coconut oil or olive oil to massage the perineum pre-delivery, pre-labor to kind of help to soften and loosen up the tissue. But that vaginal stretching thing where you take, your index and your middle finger and you're like stretching out the vagina, like you're really doing something. I'm like, really? But anyway, we found this to be quite amusing and shared a really good laugh. And I'm actually waiting for her to ask some of my other colleagues that participate in this practice what benefits it adds, because again, inquiring minds want to know. And then furthermore, another interesting thing that the nurse said to me was, well, my patients sometimes don't like when their doctors do that. And I'm like, well, tell your patients to tell their doctors not to do that. I mean, the thing about the physician-patient relationship is that it is a two-way street. You've got to be able to have those kinds of conversations with your physician. And if you can't, perhaps you should be finding another physician. But anyway, I hope that this quick Q&A has answered someone's, hot question, or perhaps informed you nonetheless. And if you happen to have a question that you would like submitted to the podcast, just go to the website, my website, www.askdrangela.com. That's ASKDRANGELA.com. And you can access me through any of my social media platforms that are readily accessible on the site. A lot of people submit questions via direct messaging. there's also a big question mark that you can click on and submit your question via email. A lot of people feel a little bit more secure with that mode of questioning rather than leaving a voicemail. So I can't wait to hear from you. Keep those questions coming. I absolutely love hearing from you. If we do happen to use your question in the podcast, I will reach out to you, or someone from my team will reach out to you, and we'll send you one of our bomb-ass t-shirts. In closing, I'm going to leave you with this recommendation. Become the most positive and enthusiastic person you know. Until next time, look better, feel better, be better. Looking forward to reconnecting on episode 175 of the Ask Dr. Angela podcast.
Thank you for listening to the Ask Dr. Angela podcast. For more information on women's health and the show notes for this episode, please visit Dr. Angela at www.askdrangela.com. While you're there, don't forget to leave your own message for Dr. Angela. See you soon! All of the information provided and discussed in this podcast is for educational and informational purposes only and should not take the place of consulting a physician. This podcast is not intended to diagnose, treat, or cure any disease or illness and does not and should not replace treatment from a medical professional. Listening to and participating in this podcast does not create a doctor-patient relationship between you and Dr. Angela Jones. If you need medical advice or assistance, you should consult a physician. Listening to and participating in this podcast is subject to the terms and conditions posted at askdrangela.com/terms.